Our goal is your satisfaction. Let us show you the way.
Should I go to urgent care for nasal vestibulitis? Most minor sinus infections get better on their own without the need for medical treatment. More severe sinus infections, however, require urgent care. First and most importantly, it is important to seek urgent care for a sinus infection if the symptoms begin to worsen or last for an extended amount of time. When should I see a doctor for nasal vestibulitis? See a doctor if the nose feels sore or itchy, or there is a rash, redness, or a pimple inside the nose. The symptoms of nasal vestibulitis do not improve after a few days of taking antibiotics. The infection spreads or a person develops a fever after beginning to take antibiotics. Will neosporin help nasal vestibulitis? Use Vaseline petroleum jelly or Aquaphor. You can apply this gently to each nostril 2 to 3 times a day to promote moisturization for your nose. You may also use triple antibiotic ointment such as neosporin or bacitracin. These can all be bought over the counter. How long does it take for nasal vestibulitis to heal? Treatment for nasal vestibulitis. Most cases of nasal vestibulitis can be treated with topical antibiotic creams, such as bacitracin ointment or mupirocin. You may have to use these ointments twice a day for 14 days. How do you heal a raw nose inside? Home treatments. Applying petroleum jelly or using nasal saline spray to keep the nasal passages from drying out. Using creams like pain-free neosporin to fight infection and reduce pain. Leaving scabs alone and not picking at them. Not smoking or using drugs. How do you treat nasal vestibulitis naturally? Mild cases are often cleared up with warm compresses, daily cleaning of the area with a cotton swab soaked in hydrogen peroxide, and application of a topical ointment. If a bacterial source is suspected, then a topical antibacterial ointment may be applied directly to the affected nasal vestibule. How do I get rid of a painful bump on my nose? Warm compresses. Applying warm, moist compresses to your nose can help to reduce the pain and discomfort associated with the pimple. Try using compresses 3 times per day for 15 to 20 minutes at a time. Can sinuses excruciate pain? Sinus pain can range in severity from a mild headache to excruciating head and face pain, toothaches, and earaches. Regardless of the underlying cause, sinus pain usually develops as the result of inflammation and congestion in the sinus cavities. Can sinusitis cause hospitalization? Patients are usually admitted to the hospital for a CT scan to see if fluid needs to be drained, Dr. Sandwani says. Also, in rare cases, sinus infections in the rear center of one's head can spread into the brain. This can lead to life-threatening conditions like meningitis or brain abscess. Drive.
Take our lead. Let's help you make your mark.